Welcome to this online session of ophthalmology from Joint Shantou International Eye Center. I'm Dr. Wang. Today I'm going to share with you something about presbyopia. Have you ever noticed how your grandparents read a newspaper? I guess you are so confused why they always put the newspaper at a far distance unless they get used to wear a pair of reading glasses. We always take it for granted that people see clearly when they keep the objects closer. However, for elder people, these rules might not hold. Sometimes they just complain about blurred vision and near, even if the distance vision is normal. Before we discuss this phenomenon, we should know about the biological process of accommodation. With distant vision, the incoming light rays are coming in parallel and end up focusing on the retina if without refractive error. In contrast, a near object produces expanding divergence rays of light which end up behind the eye. So the eye needs some more reflective power to get it in focus. Fortunately, we are born with the ability to increase the reflective power by making the lens rounder. This process is called accommodation, controlled by the third cranial nerve. However, accommodative ability decreases with age because the lens become harder and less flexible, and it is not easy to get rounder. The amplitude of accommodation decreases throughout life until 60 years old. By definition, presbyopia, also called old sight, refers to the blurred near vision due to the loss of accommodation that comes with aging. But remember, besides the aging change, other less common causes of accommodative dysfunction include disorders of the third nerve and the ciliary ganglia, as well as drug effects such as atropine and anti-Parkinsonian drugs. Strictly, presbyopia doesn't belong to the category of refractive error. When we talk about the refractive error, we discuss the refractive status with the setting of distant parallel light ray without accommodation. Conversely, when we talk about presbyopia, we are thinking about the reducing accommodative ability with age, affecting near reading mostly. Presbyopia typically occurs around 40 years old and continues to worsen until 60 years old. In clinical practice, symptoms of bilateral and progressive blurred vision and near with eye strain in patients with appropriate age are usually enough to make the diagnosis. I believe you have heard that a myopic guy will not develop presbyopia. Unfortunately, that is not the case. To all people, once you get older enough, you get presbyopia eventually. Indeed, the age of onset of presbyopia depends on the original refractive error. My myopia may delay symptoms of old sight since they only need few accommodation for near reading. In contrast, patients with latent hyperopia may present with premature old sight, usually younger than 40 years old. That is because they already use a portion of accommodation reserved to focus at distance, and needless to say the difficulty of near reading. Treatment of presbyopia involves the use of plus lenses for near work, either in a setting of bifocal lenses or reading glasses. Reading glasses are convex lenses that increase the refractive power. Bifocal lens is recommended for patients who need refractive error correction for distant vision and presbyopia correction for near vision simultaneously. Upper part for distant and lower part for near work. Most patients with eye strain feel better with plus power glasses for reading. An alternative is making the non-dominant eye myopic through surgical method, especially for patients older than 40 years who consider refractive surgery for myopia. On the other hand, cataract surgery with implantation of multifocal intraocular lens is also designed to deal with cataract and presbyopia. In summary, presbyopia refers to the age-related loss of accommodation which brings about difficulty in near reading and needs plus lens for near work. Once we get an aged patient corrected for distant vision, we need to take care of close-up vision. And here are the references. Thank you very much for joining us.